So today I want to talk about IT band syndrome and how it affects runners, but also how can you actually start to treat this and kind of break through some of the misconceptions about IT band syndrome. So first things first, always make sure that you're checking with a doctor or a physical therapist if you are dealing with a specific injury. This in no way is prescriptive for anybody, and I want to make sure that I am covering myself as well as making sure that you are staying safe when dealing with certain injuries. Now with those disclaimers out of the way, let's talk about IT band syndrome. So what is the IT band? First of all, it is the iliotibial tract that is coursing from the hip down to the knee, okay? And it goes along the outside of your thigh. So if you are dealing with IT band syndrome, a lot of times what you might feel is some kind of pain either on the outside of the knee, the outside of the thigh, or on the outside of your hip. So this is very typical in runners, or not typical, but it's a very common injury in a lot of runners. And some of the things that actually cause this are certain areas of tightness in the muscles around the hips and going into the legs. And then there's also biomechanical issues as well. And then there's certain amounts of strength that we need as runners to be able to maintain certain hip stability so that the IT band doesn't become irritated. Now you may have seen or been told about how to foam roll the IT band, and there's a lot of people out there that just hop on a foam roll and they just kind of roll for days and it just never even gets better. And there's a more targeted and better solution to dealing with IT band syndrome, and I want to make sure that you guys understand some of the good treatment options when it comes to dealing with this type of pain. Now first things first, the IT band it's really more of a tendon than it is a ligament or a giant piece of fascia. I mean, it's all fascia, but it's more of a tendon than it is anything else. And there's a couple of muscles that attach into this tendon that then come down and attach to the outside of the knee. Now, if we're talking about stretching out a tendon, it's going to be very difficult to stretch out this piece of tissue. Number one, there's not really a good way to do it that's actually going to put the IT band on enough tension that it's going to actually put it on enough tension to start to lengthen. But then there's also just the fact that it's extremely strong tissue, and for you to feel like you're going to actually start to extend and lengthen the tissues of the IT band, that's probably one of the biggest mistakes that people make. So just foam rolling on the IT band all the time or doing some sort of IT band stretch, these are pretty ineffective, and some people have seen it work for them, but for the most part people come in and they tell me, yeah, I've tried the stretches, I've tried the foam rolling, but it's just not working. And this is one of the biggest frustrations about IT band syndrome. So the question then is, if the IT band is not what's tight, then what is creating that sensation of tightness or tension that is pulling and tugging on the IT band, either on the outside of the knee or up in the hip? So quick little anatomy lesson. Let's talk a little bit about what's going on around the IT band. So we're taking a kind of a side profile view here, and forgive me if my art is not up to par, but I tried to represent it as best I could. So this is your pelvic bone, your iliac crest along the side of your hip, and the IT band starts from there, so iliac, the I, and then T is tibia, so it comes down and attaches to your tibia or your shin bone. So iliotibial band, IT band. So it comes all the way down the side. Now I have really delineated this in a nice way visually, but here's what's really kind of happening is these muscles that come all around the IT band, they all kind of start to attach into it and they become continuous with it. So they start to actually come in and form the IT band, and that is why this is considered a tendon of the glute max of the tensor fasciae lata muscle. And then coming down, what we'll see is this is not just a straight band of tissue, but it's actually kind of connected with the quad on the front. It's connected to some degree with the hamstring on the back. So this is, there's connections here all throughout the IT band, which is why there's certain areas in our body that can get tight that can then start to pull and tug on the IT band, creating problems along the entire tract. So when people try and do foam rolling, what I'll see a lot of times is they'll jump right on the foam roller and they'll just kind of go really generally across the entire IT band, up and down, up and down, up and down. And that is not as effective as if you do certain targeted foam rolling exercises. So for me, if I am treating a tendon, whether it's the IT band or anywhere else in the body, I'm not going to foam roll or do a whole lot of soft tissue work right around the tendon per se. I'm going to do it on the connecting soft tissues that are potentially acting on that tendon. So I'm going to foam roll in the TFL area, I'm going to foam roll in the glute max area, I'll foam roll along the hamstring, and I'll foam roll along the lateral quadriceps. Now you might also consider that if the muscles around the hip, say the glute muscles or the TFL, if they're not very strong and they don't create good hip stability, then what it's going to do is you're going to get this kind of tip in your pelvis called a Trendelenburg sign, where the opposite hip is going to drop if this side is not very strong, which can then put a little bit of increased tension on the IT band and create pain either at the hip, or it can lead to what's called a valgus sign at the knee, creating tension and pain down towards the knee as well. So, you can have discomfort along the IT band pretty much at any point, but it's very, very common to have it right at the outside of the knee or right up here kind of on the hip pointer as it crosses over that big bone right on the outside of your hip. So that's why hip strength and hip stability is going to be extremely important to develop in order to help to treat or prevent IT band syndrome from happening to you as a runner. Now, if you guys are interested at all in seeing how I would actually go about treating this for a runner, I would love to make a video for you guys, but I'm not going to make it unless you guys really, really want it. So if you guys are interested in seeing, what's the foam rolling routine that I would normally give somebody? What are the strengthening exercises that I would normally give somebody if they are dealing with certain areas of pain along the IT band? And if you are interested in seeing, what are some of the biomechanical cues as well, because there are certain kind of running forms that might lend to increased quad activation, and when that quad is overactivated and starts pulling on that IT band, it can create significant IT band problems. So let me know if that's a video that you guys would like to see me make. If you would like to see, what would be kind of a treatment plan or treatment option. Of course, it's not prescriptive for anybody specifically on this channel, but in general, how would I go about the thought process of treating an IT band syndrome? Let me know in the comments below if that's something that you guys are interested in seeing. So also let me know in the comments below if you've ever dealt with IT band syndrome, and what did you do in order to get rid of it, or are you currently dealing with it now and needing ideas on how to go about treating it? Are you going to see a physical therapist? Are you doing your own self-treatment? Are you foam rolling in a certain way? What are you doing in order to help relieve or alleviate or get pain relief for your IT band syndrome? Or if you've had it in the past, what did you do before? So I hope that video was helpful for you guys. Let me know in the comments below if you have any questions whatsoever. Now head on out there, seek your elite. God bless, and I'll see you next time.